What if I told you that addiction isn't just in your head? Stress, sleep, and even your gut health could be fueling your cravings.
Your gut is populated by a whole bunch of different microbes. The crew that is called in to break down the food is based on the environment. When I'm stressed, I have a whole different cadre of microbes in my gut that are breaking down the food and preparing me to fight or flee.
In this eye-opening conversation, Dr. Snipes uncovers the hidden science behind addiction and recovery from a perspective you haven't heard of yet. If you are a man ready to level up your game in life, subscribe to the Man Within podcast channel right now.
Welcome to the show. Thank you so much for being here.
Thank you for having me, Satya.
Yeah, it's man, it's just such a pleasure. You have incredible content, really covering the gamut of mental health illnesses and issues. But you do have an emphasis on addiction and even on pornography addiction. And so I think you and I have a lot to talk about today. But I want to just maybe start with some backstory because you're very well known on YouTube, over 500,000 subscribers, and really, you're not the person who took the more complicated mental health subjects and try to, put them bite size and make it really digestible. You give like the hard, raw stuff. You have slide decks and it's really comprehensive what you're putting out online. So maybe my first question is, are you surprised at the level of traction you've gained given how in-depth your teachings are and how it kind of goes against the grain of what people normally tell you to do with content online?
Honestly, I am. I'm very surprised because you know how it is when you're on YouTube getting your first 100,000 subscribers, then you're assigned a coach. And one of the first things my coach told me was, you need to cut this down to 10-minute segments. And she listed off a couple of my competitors. And I said, that's not what I do. I think there are a lot of people that are out there that are providing the introductory bite-sized information, and that's wonderful. But some people are looking for that deep dive to understand more about it. And in recovery, you know that just understanding the superficial aspect doesn't help you actually apply the knowledge. You have knowledge, but you can't do anything with it. It's like, okay, addiction, it's a brain disease. All right, what do I do with that? How does it help me? And I think it's really helpful. I've been trying to use the word disrupt the mental health community and really get clinicians and other people to start thinking about how their physical health and their mind interact and how stress causes inflammation, how inflammation is correlated to, if we don't want to say causes, depression. So I'm really trying to get people to think. And the slide decks are simply because I'm a visual learner and I would, rather pull my eyebrows out than have to just watch somebody with a bobbing head on a screen for an hour. But that's me. That's my learning style. So that's why I have those. And a lot of people have indicated that since the content is longer, they do like the slide decks because they can take more effective notes and it's easier to skip ahead. They're like, okay, let me find that slide where she was talking about XYZ.
Yeah, but you're a great example of somebody who clearly loves the learning process and it comes through in your content. And even you just explained the method that you're delivering the content, I think is really, really cool. Tell me about disrupting the general approaches to mental illness and disease and obviously mental wellness. What are you referring to when you say that?
I started out my career working in an addiction treatment facility, and I learned an immense amount of stuff, way more than I ever learned in graduate school. I will honestly say that. However, at that point, back in the day, we were just starting to understand co-occurring disorders. We were just starting to accept that addiction and mental health issues, more often than not, happen together. And it makes a lot of sense. But at that point, and even up until the past 5 years or so, as a profession, we really haven't recognized the impact that our body has on our mental health, our gut microbiome, our vagus nerve, our autonomic nervous system with that rest and digest or fight or flee, and helping people really understand that a lot of this stuff is not, quote, just in your head. And I think it's so important that we communicate that because most of the people who are practicing now were not taught that in graduate school and probably never learned it. And you can only help a person recover or work toward their rich and meaningful life so much if they've got underlying issues, if they're depressed, not only because of stuff going on in their life, but because their dopamine system is out of whack, because they're hypothyroid. Some of those things, because they've got nutrient deficits or their circadian rhythms are out of whack. Those are some of the things that I look at pretty much the minute somebody walks in, and when I'm seeing patients, and to try to find out what else is going on. There's this stuff over here, the thoughts, the beliefs, the feelings. We can deal with that. But let's look at what else is contributing to it. And then I want to help people see how it's bidirectional. When I'm stressed, it negatively impacts my body. And when my body is sick or inflamed, it negatively impacts my thoughts and my feelings. So figuring out where we can intervene is really helpful. And with porn addiction, for example, and it's true with some other addictions, but it seems to be more prevalent with porn addiction, that there's a lot of people who are struggling that aren't getting good quality sleep. And I know you're kind of scratching your head, or some people are, saying, what does sleep have to do with porn addiction? Oh my gosh. Once you start disrupting your sleep, it disrupts your circadian rhythms. So it's harder to get good quality sleep. And when you don't have good quality sleep, you are more prone to notice the threats in the environment. You're more prone to feel stressed and irritable. You're more prone to have difficulty controlling intrusive thoughts and ruminations, including cravings. So it becomes so much harder to stay in recovery, to stay clean and sober, when your brain's kind of gone off on its own thing and you don't have as much ability to control it. And certainly that is one of those interventions that a lot of people are like, well, why am I learning about this in counseling and not from my doctor? Oh, no.
Yeah, well, I think you just probably blew a couple people's minds, but it makes so much sense. Like it's the first domino to fall in a cascade of events, right? And it sounds to me like what you're describing. In my head, I'm thinking this is functional medicine meets clinical psychology. So I guess the next natural question for me then is, if you're a trained clinical psychologist, then how did you discover the integration of some of these more functional medicine? Maybe you'd use a different term, but you know what I mean. How did you integrate these two worlds together?
The best way I can say is I'm a nerd. I want to know why. I want to know, and working in addiction treatment for 20 years, I'd have people come in and apparently reach a level of recovery, reach a level of sobriety, and then they'd discharge from treatment and they'd be out back 3 months later or 6 months later. But some people wouldn't be back. And it was because they had maintained their sobriety. And I said, what was different? Because clearly what we're doing is not working for everybody. I have one person that I worked with for pretty much that entire 20 years who relapsed 13 times and came back to our facility 13 times. And my thought is, even then was, what we provided you the first 5 times didn't work, the next, whatever the math is, we're probably not going to be able to help you that much. But why? What is different with this particular person? And that's when I discovered PubMed. And PubMed is actually my recreational reading, which is really kind of sad, because I'm curious. Curious. Like, one of the rabbit holes I went down recently was about oxytocin. And oxytocin is actually a powerful neuroprotective agent as well as an anti-inflammatory.
Wow.
In addition to being our bonding hormone.
So interesting.
Looking at the ways that they're starting to use oxytocin in treatment of autism spectrum disorders, schizophrenia, depression, is really exciting to me, because we're looking at something that may be available to people for which the current treatments are not working.
It's very interesting. Well, I was just looking at a study that said people who are married are more likely to live longer. They have lower risks of autoimmune disease. There's a whole list, and I think the oxytocin thing. I think you just explained the mechanism behind it all. It's really interesting. Can you talk a little bit more about inflammation in the gut? And sorry, I didn't want to cut you off if you have another thought there as well. But inflammation in the gut, how that correlates with, you mentioned depression. Is it what's the link there? How does that work?
Your gut is populated by a whole bunch of different microbes. And those microbes are designed to break down the food you eat and turn it into hormones and neurotransmitters. Okay, simple enough. The crew that is called in to break down the food is based on the environment. When I'm stressed, I have a whole different cadre of microbes in my gut that are breaking down the food and preparing me to fight or flee. They're preparing the end products to do something else. When I'm relaxed, then I have the relaxation microbes in, and they're breaking it down and helping my body produce things like GABA. When we are stressed a lot, then we start to have a dominance of the stress-related microbes. And we have a nerve, which a lot of people have heard of, the vagus nerve. It's called vagus. Vagus means wandering in Latin, for what it's worth. But it goes through every organ we have. And it actually kind of starts up here with your trigeminal nerve, and you've got a little arm of it right on your ear, your jaw, and it goes down, but it connects in your gut. And one really fascinating study that I read, and sorry for the rats, but they had a group of rats, and one group of rats had their vagus nerve cut, and the other group of rats did not. And they were both fed a diet of probiotics. And the rats who had their vagus nerve cut had no differences in their attitude. The rats that had the intact vagus nerve, their mood improved, their energy improved, their drive, so I guess we'll call it motivation for rats, improved. And they found that by manipulating, can't speak, the gut microbiome, they were able to actually affect people's mood and cognitive abilities, which was really fascinating. So it goes both ways. Again, if you're stressed, you're causing stress on your system, which is going to send the message up the vagus nerve to your brain that says, hey, this is not a good thing. We're stressed. And that's going to trigger the sympathetic or the fight or flight response. But then that also can lead to inflammation in the gut. So when you're not feeling well, when your gut's upset, we all can get indigestion if we get too upset. That sends another message to the brain that, hey, there's a problem. And so again, that fight or flight is triggered. And the more the fight or flight is triggered, the less able the body is to tamp down that inflammation, even when it's time to tamp down the inflammation.
Yeah, it makes a lot of sense. I was actually just meeting with my functional medicine doctor earlier this week, and another angle he gave on stress is that if the body is under stress long enough, the gut can become more permeable. And so instead of having that kind of tight cell membrane wall that keeps everything where it's supposed to be, it becomes more permissive, and you can start to get pathogenic strains of bacteria and, all kinds of issues. I think leaky gut is what they would call it, or hyperpermeable gut, that kind of thing. So the stress one's a big deal, something that I'm really trying to address in my own life after a couple of years of hustling and grinding, building a business, and a young father now, and, kids and all that kind of stuff. And so less sleep and trying to just trying to figure out how to navigate it all. So when somebody comes to you, you mentioned earlier, sure, we can deal with the beliefs and the thoughts and maybe the things that are more in that arena of clinical psychology. How are you, like, from a diagnostic perspective and certainly from a treatment perspective, what are you doing to integrate these two? How do you know when to do more of the gut, hormone, that kind of profiling versus maybe the more clinical psychology realms? And when do they intersect? How do you go between one and the other? I'd just love to know the interplay there.
The first thing I do is a very complete intake. And one of the first questions I ask is, when was the last time you had a full physical with a full blood panel that included your thyroid hormones as well as your gonadal hormones. Because a lot of times the docs won't run those.
Yeah,
Also
true.
want to know about blood sugar, because more than 60% of Americans have some level of insulin resistance, which is another thing that contributes to inflammation and neurodegeneration. And if they say within the past year, I'm like, great. Can you tell me, were there any problems? Most of the time, they're like, I don't know. May have been 5-6 years. My husband probably hasn't, I can't remember the last time he had. Oh, yes, I do. It was about 13 years ago. He had a physical.
Wow.
So recognizing that and recognizing even those physicals, his physical at that point was for flying, a flight physical. So he didn't have his gonadal hormones tested. And he was young enough at that point. It wasn't theoretically a concern. But our gonadal hormones, our testosterone, our estrogen, progesterone, all of those hormones make your neurotransmitters more or less available in the body. So it's important to recognize what the underlying issues are in what I call the body factory. What's keeping the factory from operating optimally. And then, of course, I ask about their social situation, their living situation, spirituality, all that kind of stuff. Do that full intake. And I generally start by saying, what do you think is causing your problems? And if they know, great, we'll start there. Otherwise, I might say, this is what I see. I see you're not getting enough sleep. And that's potentially causing some problems that we can talk about and making your cravings worse, making your depression worse. I see your circadian rhythms are gone. Your nutrition, your body hasn't seen a green vegetable in 3 months. So that's probably a problem too. Exercise, we go through the different things in the different areas. And I say, these are all things that we could address. And the wonderful thing about the human body is once you start pulling one of those threads in the blanket, everything else starts to unravel. So if you've got this blanket of disease over you, anything you do to reduce stress on the body is going to improve the functioning of the body. And I generally start with wherever the person wants to start, because that's what they're going to be most motivated to follow through with. Typically, if they haven't had a physical, I really push them to do that, even though a lot of people don't like going to doctors. But for a lot of people, they tell me what is it they think is the best place to start. Could be communicating with their spouse, could be, who knows?
Yeah.
And so that's my approach. I try not to be overly prescriptive or directive, because I've worked with a lot of people who, that feeling stuff, that's the F word to them. They don't want to go there.
Yeah.
And I've worked with other people who one of their big issues is their shame and their guilt for going against the teachings of their faith, and they feel ostracized. And it's that guilt that's so oppressive that's causing them to feel depressed and overwhelmed and hopeless. Okay, so we'll start there.
Yeah.
And that's really important for people to recognize, is as a person in counseling, I don't like the word patient because that sounds too clinical. As a person in counseling, you are in the driver's seat. You have the right, and maybe some would say the obligation, to tell your therapist, this is the problem I see. This is the end point I want to get to. And these are the things that I think might be helpful. And if you're not making progress, reassess. The therapist does not know everything. The therapists are catalysts. We are there to say, hey, I have this tool that might work a little bit better. Do you want to try it? I'm not here to fix anything for anybody, because only each person can fix themselves. And that's something else that's sort of disruptive in my profession, is me coming out going, if you've been seeing your therapist for 10 weeks or 10 months and you don't feel like you've made any progress, you need to look at what's going on and talk with them, because it shouldn't be just coasting along. You should feel like you're making progress toward whatever your goals are in your rich and meaningful life.
Yeah, I think you were generous there with those time frames, because we have some clients who have been seeing the same therapist for years, and plateaued and kind of just being told to trust the process, or it's a little bit aimless. And I know how frustrating that can be for people. So I like that you're calling therapists out, and I know that's a huge part of your work as well, right? Is helping other therapists and practitioners really advance their education and be informed and up to date on what I would say is maybe some more modern science, since they did their more formal training. So I think that's all really, really amazing. I wanted to ask you about stress in the nervous system. You really emphasize the nervous system in your videos. Your best viewed video on YouTube is all about inner child work, which I want to get to in a minute, because obviously that has a nice tie in here. But talk me through why stress in the nervous system. What's the interplay there, and why is it that when our nervous system is healthy, and it doesn't mean that we're never in fight or flight, but we're able to regulate again when we are, why is this so critical and so central to the well-being overall?
The short version, and I'll do a detailed explanation, but the short version is, in your autonomic nervous system, you've got the rest and digest response, the relaxation response, and the fight or flight response. And the longer you're stressed, the stronger that fight or flight response gets, and the weaker that rest and digest gets. So you start developing this imbalance, which is why we start talking about improving vagal tone, so people can feel like they are able to basically manually override, if you will, the stress response. But the stress response, when it is functioning as it should, something happens, you get stressed out, and your fight or flight kicks off. It dumps cortisol, which is a steroid, and cortisol is designed to help us get energy and perpetuate this cycle, but it's also an anti-inflammatory. So when you're doing whatever it is, when you're running from the hungry lion, you're not thinking about how much pain you're in. So cortisol, thyroxine, norepinephrine, dopamine, because dopamine's our motivation chemical, and it's saying, yeah, I want to survive, kind of want to run. And that's wonderful. And then when your body registers, hey, the threat has passed, then the rest and digest kicks in and says, okay, we can calm down. And at that point, what we call inflammatory cytokines are sent out. And I think of them sort of like your little ambulances of your body. And they go around and see, is there anything that was broken during the fight or flight response that needs to be healed? And if not, fine, go back to base. Everybody's happy. Over time, when we're stressed for too long, just like when somebody drinks alcohol, and the first time they drink 1 or 2 beers, they may get really buzzed. But after they've been drinking for a while, their body develops a tolerance, and their receptors just don't care. They're like, 6-pack, that's kids play. Give me something to work with. But your body does the same thing with cortisol and some of those other hormones. So when you're stressed for too long, cortisol loses its ability to suppress inflammation. So then you start having systemic inflammation 24/7. And that registers as a stressor in your body, which triggers the stress response to stay activated. And you've got this sort of downward spiral as everything gets more inflamed and you get more stressed, either physically or mentally or both, starts negatively impacting your sleep. It puts you in a place where you're more likely to be aware of negative stimuli in the environment and causes a lot more stress. So as we start healing, as we start helping people develop awareness of their emotions and anger, I don't want to get rid of it. I don't want to get rid of anxiety because they're there for a reason. Yeah. But it's like the smoke alarm in my house. Just because it's going off doesn't mean there's a fire. Probably means I left something on the stove. But it's a warning sign. And so I get stressed, and it gives me the energy to get up and look and say, is there a problem? And in a functioning situation, I look around, I say, no problem, no big deal, turn off the fire alarm, we're good. when your nervous system is working, that's what happens. Somebody feels stressed and they develop the skills to acknowledge, hey, I'm feeling anxious right now. Wondering if there's a reason to be anxious. They get grounded. They use their distress tolerance skills. They evaluate the situation and then determine what to do. I mean, it's a pretty practical scenario. But when we're in fight or flight, we are not using our executive functioning. We're not using that prefrontal cortex to think about, okay, logically, what's going on right now? And when people can't think clearly, then they are using emotion-based reasoning. This must be dangerous because I feel anxious. No, not really. So that's why it's so important to recognize the impact of the nervous system. And when it starts to get imbalanced, it creates problems. Another interesting little tidbit, I guess, is as we age, our sympathetic nervous system, our fight or flight, actually starts to become more dominant. And part of that has to do with the decline in some of our gonadal hormones. But if you think about, well, in my family, as my relatives aged, they got a little more rigid and a little more irritable. And that's because that fight or flight was becoming more dominant. And yes, it's possible to reverse it. When I work with people in assisted living facilities, one of the things I like to use is biofeedback. And we just use a straight polar heart rate monitor, nothing super fancy. We go on a walk, we come back, and then we sit down and they work on slowing their breathing and see how they can slow their heart rate and their blood pressure. And then I encourage them to practice that when I'm not around, when they start getting stressed, and notice how their blood pressure goes up, use the same skills and notice how they can bring their heart rate and their blood pressure back down. So they're starting to develop that manual override. Even if the rest and digest isn't kicking in on its own, they can kick in, they can use those skills and get into their wise mind and say, hey, there's nothing to be stressed about right now. Or being stressed about this isn't going to change anything. And therefore, I can make a conscious choice about how I use my energy.
Yeah, that's really powerful. And it makes a lot of sense. You're reminding me of, have you interacted at all with a woman named Dr. Trish Lee? Does that name ring any bells to you?
No.
So she's very popular on YouTube as well, a double PhD in neuroscience. And we were having right up your alley. And I'll have to connect you guys afterwards. I think you'd have a lot to talk about. She, on our podcast just maybe 6 months ago, she was talking about how a lot of people, especially in the porn addiction conversation, talk about boredom. I was bored and that's why I started watching pornography. And her theory is nobody knows what boredom is today. It's just that we're so overstimulated and so acclimatized to fight or flight that we think normal levels of regulation or even just a normal level of stimulation, we consider that to be boredom because our calibration is all kind of off. And I'm wondering in this conversation that we're having here about the nervous system, regulating it, obviously getting out of dysregulation so that we're not prickly and rigid and making poor decisions and all that kind of stuff. What do you think technology does in this conversation? Because you started, I believe you started early 2000s from, if I did my research correct, with your clinical work. And so technology certainly has come a long way in 2 decades. Have you observed any shifts in how are we more engaged in our fight or flight state now because of tech and social media and all that kind of stuff? Just what's the interplay on those fronts?
Well, I'll tell you, when I watch one of the movies from the late 80s, when I was, in high school, 90s, college, anymore, they seem so slow. And, I'm like, can I just put this on fast forward a little bit? Let's have some action.
Yeah. Even the intros are like 3 minutes long, right?
Oh my gosh. So it's certainly training our brains to expect a whole lot more input. And I think that's a problem. Having this 24/7 input doesn't give us the chance to ever really give our brain a break. And there are 3 things that set our circadian rhythms. Light, as everybody knows. Temperature. Cooler temperatures are associated with sleep and rest. and social activity. And people stay on their devices right up until they get ready for bed. Additionally, their devices just emit immense amounts of blue light, which isn't good for the light and circadian rhythms anyway. The fear of missing out adds a whole lot of stress. What am I missing? That I'm not on my mobile device right now. What is going on that I need to know about? And need is
strong word there.
Yeah, kind of a strong word there.
Sure.
But and helping people develop the ability to sit with their thoughts. So many people that I work with right now have such palpable anxiety and depression and hopelessness and just fear of other people. It's like, I'm afraid to say anything to anybody because I might be canceled or rejected, which goes to that inner child thing that we'll talk about in a second. But for a lot of people, just sitting still and being quiet is oppressive, if not terrifying. And helping people learn to start doing that in small bits. And when I say small bits, I'm talking about a minute. Let's try meditating for a minute, just noticing. I do a lot with open awareness meditation where you're just paying attention to what's going on. I have bird feeders outside. We live on a farm. So I spend time just looking and trying not to think about anything else for a couple of minutes. Give my brain a chance to sit down and kind of notice the world. But it's really hard to do that. And, even going back to things go too slow, sometimes I'll get frustrated because the birds aren't coming fast enough. And I think, how ridiculous is that? Just be patient. So yes, I think technology has helped us in a lot of ways, but it has caused us to be completely overstimulated and have difficulty focusing on any one thing for any period of time.
Yeah, I agree. I mean, I remember a few years ago, we did a client event in Texas, and as I was prepared, I did a talk, and I called it the 3 superpowers of the 21st century man. And one of them, I think it was the first one, was the ability to focus, because I think we are such a divergent society now. And we don't even realize it, right? It's happened very gradually and very subtly, but we're unbelievably distracted. So I do think that whole subject is going to become more important. Let's talk about, when it comes to the nervous system, if we can learn to really regulate our nervous system, you talked about open meditation, breathing, there's a lot of different things that I think in a given moment, if you find yourself dysregulated, you can get back into, what we would call your green zone. You can get back to that place of stability. Inner child work also, a different modality, a deeper modality that also plays into this. And I wonder if you can maybe connect those dots for the audience. How would something like inner child work help somebody regulate their nervous system better?
Well, let's think about a kid. When kids get upset, they generally go from 0 to 100 like that. They don't have distress tolerance skills. They don't have the impulse control skills. I always do that when I talk about the prefrontal cortex. Sorry. They don't have the impulse control skills that we as adults do. So when they want something, they tend to throw a tantrum. When they're excited, they're just like bebopping along, and then it's the best thing ever, which I wish I could get back to that. But the inner child is the part of you that was wounded, assuming we're talking about a wounded inner child. And when situations arise that remind you of those times when you felt hopeless, helpless, terrified, that part of you actually sort of wakes up, and we start acting in our inner child. We start acting based on like we would have when we were 5. I don't want that. And by learning to manage our nervous system, we can recognize, hey, I'm 50 some years old and I'm acting like a 5-year-old. This probably isn't where I want to be right now. And then step back and take stock of, why am I feeling like I want to throw a temper tantrum like a 5-year-old? What is being triggered in me that's reminding me of this? And then I can start to process it. I can help that inner child in me feels safe. Have you done much work or looked at internal family systems theory?
Yeah, absolutely. Yeah, of
Okay.
course.
So internal family systems theory talks about that wounded child, and we all have one. Some are more wounded than others, and that child, that part of you that remembers feeling unsafe, still feels unsafe. And until you can develop a secure attachment with self, where the adult you can tell the kid you, hey, you're safe, then you're going to have this constant back and forth of feeling disempowered, which
Mm.
part of being able to regulate your own emotions and downregulate when you get stressed is the adult you saying, kid, I got this.
Yeah.
It's going to be okay.
Yeah.
And as a father yourself now, you can imagine how that child can
Yeah.
de-escalate really fast as soon as they say, hey, the big guy's got it.
Yeah, it makes a lot of sense. And I think very understated, right? Like just the impact of exploring the connection between childhood and what's going on present day. It kind of reminds me of what we were talking about earlier. Like, how could my gut health possibly be related to my porn addiction? Those just seem like worlds apart. And I think with this, it's the same. And what you're talking about is definitely what we see in our practice. When guys go through inner child work, it's not like they're never tempted again. And it's not even like they're never dysregulated again. It's just the ability to manage it, the ability to kind of come back down again relatively quickly without downward spiraling. Those things are what we start to observe. And to your point earlier, actually, about taking care of the physical needs, we're hearing more stories about guys who are quitting pornography and then they're emailing us back, maybe a year, 18 months after they're done and they're still clean of pornography. But now, one guy in particular started running ultra marathons. You have some guys who start going to the gym, start taking better care of themselves. And I think, we've often talked about how when you quit pornography, your relationship to your own body starts to change. You start to view your body differently. There's a psychological component, but the physical component is something that we actually haven't really necessarily talked a lot about. But it kind of makes sense, right? Like if your circadian rhythm is in order because you're not up late at night, you're not on a screen watching pornography, you're not throwing off your sleep, you're getting good sleep, your circadian rhythm's in order, there's less inflammation in the gut, you're probably going to feel a little bit more vitality, right? A little bit more energy, a little bit more motivated to take care of yourself. So I'm very curious when somebody does come to you with pornography addiction and you're really getting into the weeds of them. You have so many different modalities and tools in your tool belt. What are some of your favorites? Maybe we've talked about them already. Is there anything that we haven't talked about that you say, if I'm treating somebody with porn addiction, these are some things I'm definitely going to make sure I'm tackling?
Like with any addiction, it's hard to know what triggers the cravings for any person. And one of the first things I do when I'm working with people with addictions after I do the assessment is we create a relapse prevention plan. You've come in, you've said you want to stop. Cool. Let's talk about what makes you more vulnerable to having cravings and what triggers in the environment and in your own head make you want to use, make you think about using. And if it's porn, okay. So then what can we do to create an environment that's safe for you? And we go through, I have a mnemonic called pieces. We go through all of the pieces of their life. Physically, what do we need to do to make you less vulnerable to having these cravings? And for people with porn addiction, it's not quite as cut and dry. For people who have compulsive masturbation or sex addiction, there are some physical interventions or physical things that we can do to help them be less stimulated during that sort of detox period while they reset their nervous system.
Right.
Then we talk about interpersonal. What interpersonal things trigger your desire? We'll stick with porn here. Trigger your desire to watch porn, make you think, hey, I need to go watch porn. It could be places. It could be going to the gym and seeing people all in spandex or whatever it is. Let's figure out what you can do to eliminate those triggers for now. You may not want to eliminate the gym, for example, forever from your life, but what can we do to either eliminate it or mitigate it, make it easier to deal with? Going to the gym, there are certain times at my gym where I think most everybody there is over 65. So not a lot of spandex.
There you go. That's a workaround.
That's one of those workarounds. Then we talk about relationship issues. Maybe somebody is, really feeling a desire for sex, but their partner is not wanting to have sex. And so they're justifying their porn use by saying, well, at least I'm not cheating. Well, okay, but we talk about how to have that conversation with a significant other and what things can be done that might help with their sex life and their sense of connection. And even if not sexual intimacy, their emotional and cognitive intimacy. What could happen? And why is there no sex? I mean, if somebody just had a baby, I get it. If you're not sleeping, I get it. Sex drive might be kind of low. But a lot of times there's other issues underlying that eventually we'll need to deal with.
Yeah.
But we start talking about, okay, when you start feeling like you're being sexually neglected, how can you handle this in your relationship? Then we go to emotional and cognitive, the feelings and thoughts that trigger your desire to use. And then finally, as with all addictions, environmental is a big one. All right, let's talk about putting on the nanny programs on your phone. So somebody gets notified if you go to a site you're not supposed to. Let's talk about locking down your local Wi-Fi. And, obviously they can turn off Wi-Fi and use data.
Sure.
But with the nanny app, they're going to get ratted out. Ultimately, with addictions, if somebody wants to get around it bad enough, they're going to find a way. But the thought is that if they're coming to treatment, that they really do want to stop. Yeah. And okay, so let's take away as many possible triggers as we can, and let's create as safe an environment as possible. And let's start there.
Yeah.
When I was in undergrad, I got my minor in applied behavior analysis. And so another one of the tools I use is charting. And I have them in the morning do a mindfulness inventory. What are their thoughts, wants, and needs? What are their expectations for the day? And then I also have them log their cravings throughout the day, just a hash mark, nothing big. So we can see if their cravings are going up or down. And then we can look back over their morning and evening mindfulness journals, if you will, to see, is there a connection? What's going on here that may be causing this upsurge or downsweep, whatever, in your cravings? And connecting the dots, because behavior is communication. What is this increase in cravings or decrease in cravings telling us? It's telling us you're either doing something that's not working or you're doing something that's working. And if it's something that's working, we want to do more of that.
Yeah.
And with each individual, after we build that relapse prevention plan and identify their goals, then we start, I say, these are the things that are important in your rich and meaningful life. These are the goals that you have for treatment. Which one do you want to work on first? And what do you think is the best first step for you? A lot of times it's learning about X, whatever X is, learning about the impact of pornography on the nervous system. What is porn addiction? What is the brain and what are the brain and neurological aspects of it? And talking about how, for guys, testosterone actually amplifies the effect of dopamine and the endorphins. So it turbo powers the addictive nature of the behavior, and helping them recognize that, it's not just this thought that pops up. It's not whatever. It's your brain going, I don't have enough dopamine right now based on what I'm used to. And I have this craving. The body is trying to balance itself back out to what it's used to, which is not where we want it. So we have to help it, kind of like when we go on a diet and we get hungry, we've got to talk ourselves through it and go, okay, I'm not going to eat right now because I've already had plenty of calories.
Yeah, yeah. So when are you doing hormone panels, or are you outsourcing some hormone paneling so that you can get like an idea, I guess, of how testosterone levels might be changing, or that is that part of your practice?
It's not, but if they want to do it, I obviously don't discourage it. The hormone panels get
Yeah.
expensive really fast.
Sure.
Um,
Yeah, yeah.
so generally, I refer them to a functional medicine doctor or a regenerative medicine specialist, as they call them here in Tennessee, uh,
Yep.
to do that hormone panel and identify where the gonadal hormones and the thyroid hormones and stuff are for that person. And as you know, you've got a range. This is the acceptable range. But if Jim Bob's all the way down here at the lowest end of his acceptable range, well, you can understand why he might not be feeling great.
Yeah.
So trying to encourage and advocate for the person to work with their physician to optimize their hormones for who they are and
Yeah.
what they want to do. Stress alters our gonadal hormones. Stress reduces testosterone and estrogen in women. And so we also need to recognize that as we're better able to handle our stress and as we relieve some of our stressors like that inner child, we actually might start getting some other boosts in addition to mood, because our thyroid and gonadal hormones are naturally coming back into their
Yeah.
appropriate range.
Well, that's kind of where I was going with this. I guess I was thinking if somebody's, rife with a porn addiction, they're not sleeping well, they have a bunch of things stacked against them that are affecting their hormone profile, and then they do some of the more holistic measures, or the natural measures rather. They get their hormones in balance. They're doing the inner child work. But then you also mentioned that increased levels of testosterone can actually synergistically increase the effect of dopamine. And so in the right environment, that can be a really good thing, because you're healed up, you're regulating, you're able to manage those temptations. But they're kind of part and parcel, right? Because on the flip side, if your testosterone starts to get better, but you don't have the tools to maybe manage that, that could actually do more harm than good. From a porn addiction standpoint, obviously, like, I'm isolating one component of it, but I can kind of see why you need to be able to take care of everything and kind of, do it with some simultaneity. Because if you just, pull one lever and not the other, you might end up throwing the balance off.
And that's true. And as you point out, one of the tools that a lot of people tell people who have porn addiction is, if you're not wanting to watch porn, go to the gym. Yes, exercise is healthy. I'm certainly not going to say not to. But for some people, the working out really hard increases their testosterone to the
Yeah.
point where it feels unmanageable. And that high testosterone makes the brain think, ooh, sex. Let's work on that. And so they can have more cravings for porn. And encouraging people, if you want to go to the gym, great. If you're going and you're finding it's making your cravings worse, then let's talk about that. And
Yeah.
there are things you can do to back down so you're not triggering as much testosterone production. There are other things to do besides just giving up the gym and turning into a couch potato.
Yeah, we've observed that too, and it really is individual, right? Because some people go to the gym, it's a very healthy outlet, they can clear their mind, they're more focused, it gives them something to engage their body. And then other guys where, the gym sometimes is a place where you're numbing out, you're ignoring the difficult things, you're trying to maybe channel some anger, but you're not really actually dealing with it. Like, it's very individual that way. So it's quite interesting. It's funny you mentioned ABA earlier, because I used to work with children with autism, and ABA was just a huge part of what we did. Obviously, very important for their treatment, and it's neat to see that transference into a porn addiction context, because I haven't really heard a lot of people talk about that. Is that throughout you're working with somebody that you're doing ABA? Do you do it at certain points just to kind of evaluate how they're progressing? What does that part look like?
I actually do it throughout therapy, because I think understanding behaviors are either rewarded, reinforced, or punished.
Mm.
And when a behavior or even a thought, I know we don't focus on thoughts in ABA, but when a behavior or a thought is increasing, then let's look at what the discriminative stimuli are that are prompting that reaction. We do backward chaining, we do forward chaining, and we evaluate. If I have somebody that I'm working with and they've been doing really well, then all of a sudden they've started to have just this surge of difficulty with cravings or they've relapsed. Okay, let's learn from that. Let's do a backward chain and see how we got here. And then learn from that and figure out in the future when that happens, what steps are you going to take, and practice that. And I encourage people, I do a lot with, I call it subconscious reprogramming, but for things that they want to do better, encouraging them to envision themselves doing it better right before they go to sleep, because that's when our subconscious is most primed to accept that. A lot of athletes do that. I mean, they can do it during the day too, but if you do it right before you go to sleep, then it's kind of sitting there in your short-term memory, and your brain has to figure out what to do with it. But
that's cool.
It does help prime those neural circuits and train your brain to do something different, and which is really kind of cool. And it's not a one-time thing. You can't do it tonight and then tomorrow you're going to have no problems. It's a gradual process, but we do talk about what's your progress. I do a lot with Likert scales on a scale of 1 to 5. What intensity were your cravings? What was the duration of your cravings? And what was the frequency? And if you have an improvement in either one of those 3, that's still an improvement.
Yes. Such a good point.
So there are a lot of very simple, we don't have to go into all of the super in-depth ABA tools, but there are a lot of really simple things that people can do with baseline charting and logging their behaviors and starting to understand general terms. We call them triggers, and in behavior modification, we call them discriminative stimulus. But, what's causing this? Where's it coming from? And what can I do about it? And as they start to feel more empowered, they start to feel safer. And my belief is anybody who's experienced trauma, which includes all those people who have a wounded inner child, there's a part of them, smaller or larger, that feels unsafe and powerless. And the more they start feeling safe in their own skin and powerful enough or empowered to keep themselves safe and move toward their rich and meaningful life, the better things are going to be and the less stress there's going to be.
Yeah, it's so interesting because the ABA stuff, I think it's very, very important for this. And I used to talk about it like you talked about forward chaining, back chaining. And I used to talk about it in terms of like micro behaviors that lead to macro behavior. It's like I'm watching pornography, but there's so many other behaviors that lead up to that could also be, monitored and attended to. And if you can get things upstream, a little bit further up the chain, then that could obviously have an impact downstream. I think also you glossed over it, but it's such an important point, the subconscious priming that occurs right before you fall asleep. And I think further to your point earlier in this conversation where we're talking about just why it's such a bad idea to be in bed with your phone. That's the last thing you're doing. Goodness, there's so many layers to this, but I think that's another one is people don't understand what's happening to them subconsciously, even just in that very sensitive state, what you're doing to your brain right before you fall asleep. And, we're never doing anything super meaningful or valuable at 11 o'clock at night on our phones in our beds, right? It's always something that's probably a little more frivolous. And so I think another dimension to that of why it's such an important thing to be away from your phone. I'd be remiss if I didn't ask you, Dawn-Elise, about the faith component. I know that's important for your life, and I know that you are able to integrate that if you're serving somebody who does have faith. How does that tie into everything we've discussed today so far from, ABA, like we were just discussing, inner child work, gut health and hormone balancing and circadian rhythms and sleep? Where does faith tie in, or how does that play into this aspect of porn recovery?
Obviously, as you mentioned, it depends on where a person is in their spiritual journey. And they either have completely rejected spirituality, or they're at the other end are very much of the belief that there is a higher power that can help them. And then there's everything in between. And I approach it with people starting out with in what we call in recovery, good orderly direction. GOD.
Okay, I get
And
it.
because not everybody believes in a higher power. And when you read the 12 steps, it talks, depending on which version you're reading, it either talks about God or a higher power. And
Yes.
some people, as soon as they hear that, they're just like, oh, fingernails on a blackboard. Okay. So let's think about good orderly direction. And that is the plan I have to help me logically move toward my goals. And I use the mnemonic perfects, and all of the elements of perfects are found in scripture, and they can actually be supported in Buddhist teachings. And I haven't done a lot of research on other religions, but I didn't want to stick just with Bible. But from Old Testament, New Testament, Buddhism teachings, P stands for prudence, and that is patience and wisdom. Being patient, not impulsive, and gathering the wisdom you need to make the right choice. E is endurance of trials. R is respect for self and other. And that's a difficult one for a lot of people. They may have respect for other people, but they don't have a lot of self-respect, and having to work on that. F is for forgiveness of, again, self and other. And both of those are hard. The next E is for earnestness. I'm going to commit to what I'm doing, and I'm going to do it 100%. Compassion is the C. Compassion for myself, recognizing that, I'm going to screw up. It doesn't mean I'm a bad person. I'm going to make mistakes. You're going to make mistakes. I'm going to have good days, and I'm going to have bad days. And on my bad days, I'm not going to get overly angry at myself. I'm going to have compassion and say, I'm doing the best I can right now. T stands for truthfulness with myself and other people, being authentic and mindful of what my thoughts, wants, and needs are. And then S is, of course, selflessness. And I tend to conceptualize that as recognizing that it ain't all about me. There are things that need to be done and choices that I need to make in the world that will help me move toward my rich and meaningful life and impact everybody around me. So recognizing that my choices aren't just about my immediate gratification. I need to think about, how is that going to impact my daughter? How's it going to impact my spouse? How's it going to impact my work or whatever? So we use that perfects mnemonic when we talk about doing the next right thing and getting connected with their personal values. And based on your values, is what you're doing prudent? Are you enduring distress? Are you being respectful to yourself? And we just go through it. It's not super complicated. If they are interested in related scripture, then I'm like, sure, let's talk about it. But I also connect them with Open Bible. They have a topical Bible search on there. It's not always on point, but it does a pretty good job at kind of getting you in the right area. And I encourage them to find verses that seem like they're on point, but always go to the source, because you can cherry pick a bunch of stuff out of the Bible and convince people it means something it doesn't. So go to the actual chapter and read the chapter. Figure out what Abraham was trying to communicate, or what Moses was saying, or what Peter was trying to communicate at that point. And understand it from that perspective. Because there's a lot of stuff in scripture, I'll be honest, that if you're a literalist, can feel very terrifying.
No kidding.
So I'm not a literalist, but I respect people who are, and respect their value system, and think it's important for them to find meaning in scripture, if they want to find meaning that makes sense to them, and not just trust what some talking head in the pulpit or on the television told them when they were
Yeah.
14.
Yeah. It's a very good point. I also want to mention the Open Bible is great. There's also, I'm hearing a lot more about, I believe it's called Bible Chat, which is kind of like an integration of AI and the Bible, but great for asking it questions or coming up with, scriptures. And like you said, you don't want to just cherry pick scripture. You want to make sure you're getting context. And I believe that app is really good for that if people are looking for some more
Neat.
resources. Yeah.
Awesome.
So you have you have a practice where you are serving people. You also are very passionate about training and equipping other mental health practitioners. And the way you've structured a lot of your material is that, for anyone who's listening that is a mental health practitioner, they can listen to your things and receive ECUs. I guess here we call it continuing education units, but same idea. And so I guess I'd love to hear, just when you look to the future, where are you investing your time and energy? What do you think are some of the areas that you're going to be able to make the biggest difference? Because now you have a very established platform and audience, but some practices as well that are established. What are you focused on, and what are you seeing on the horizon here for the mental health space?
I am still really passionate about furthering the narrative of the mind-body connection. That is super important for me, to try to educate people so they can stop suffering, because we know from the research that about 60% of people who take psychotropic medications don't benefit. It tells us something's missing.
Wow.
And that something is often circadian rhythms and sleep and nutrition, in addition to other stuff. And so I want to continue to further that narrative. I just finished a 120-hour training specifically for working with people that are in long-term and post-acute care facilities, people with dementia, people with anoxic brain injuries from overdosing or stroke or something else. And so I've just finished working on that, and
Wow.
I'm hoping in short order to re-record the entire training series for the addiction counselors, but that's 360 hours, so it's a little onerous to think about.
Yeah, that's a project and a half right there.
It is, but 1 hour at a time, just like recovery.
Yeah.
1 minute, 1 hour, 1 day at a time, and eventually it'll get done. But I've learned so much since the last time I recorded it about a decade ago that I think it's time to update a lot of the curriculum.
Yeah, well, and just to encourage you, like, I think you're really pioneering something with the mind-body connection. That I feel like that language even doesn't really do justice what you're doing. There's another dimension to it that I really appreciate, just with the functional medicine and really understanding how that integrates and how that can be more at the root cause than even what we would label as mental health practitioners to be the root cause, which is usually thoughts and beliefs. And so I really respect you. I love the work you're doing. We'll put links to all that in the show notes. And if people do want to find out more about you, what's the best way for them to do that, Dawn-Elise?
Gosh, I guess the best way would be to email me at support@docsnipes.com. And then I'm sure to get it. If it goes to support, it definitely doesn't go into that email box that gets 15,000 spams.
Oh, yeah. Okay, got it. So support at docsnipes.com. We'll also put the link to your YouTube channel. Just fantastic content there for people that want to go a little bit more in depth. Thank you so much for your time today, Dawn-Elise. This has been great to meet you and great to have you on the show.
It was wonderful being here, and thank you for considering reaching out to me.